welcome Dr. Hall to the stage.
Thanks very much, Alan. I feel very, very privileged to be asked to do this. And if it's okay with you, I thought I could just sit because I don't want this to feel like some kind of a lecture. I'd rather if it felt like a conversation. But I did prepare some slides just to give you some background around the whole area of sleep and to help you learn a little bit more about it so that we can have a really full conversation about whatever you might have brought you to this talk today. Because usually I find families are here for a reason, and that's usually because there's things going on in their own lives that they would like to know more about sleep for. So I'm just going to put my glasses on. I hope that's okay with everyone. Otherwise, I can't see anything. So basically, what I'm hoping to just cover is a little bit about sleep, why sleep is important, what it looks like in children, what are some really good strategies to promote sleep, what kinds of sleep problems can happen. And not all sleep problems are what we think of as behavioral sleep problems, where it's about associated around sleep. There can be underlying physiological reasons why children aren't sleeping well, and it's really important to find out about those to make sure that you rule those out so you're not treating something as what you think might be a behavioral problem when it's not. And there's also parasomnias, and I'll talk a little bit more about those, and they're not really related to the kinds of behavioral interventions that we've got, but they can benefit from them. So I'll talk a little bit about that. I'll give you a little bit of thoughts about how sleep problems can be managed and what the effects of sleep problems are, and particularly on parents. We tend to focus on children when we think about sleep problems, but sleep problems in children have really huge potential for parents too, and I'd just like to talk about that a little bit. So I'm not going to read the slides, it's just giving you an outline, but we know that sleep is really important for children's developing brains and bodies, and we also know as a society today we tend to treat sleep as a bit discretionary. People often brag about how little sleep they can go on. I only got 5 hours last night, and look at me, I'm raring to go. We've cut back on the amount of sleep we're having as adults, but what's happened to that is also it's tended to translate over a little bit to children too, so that they're getting shorter sleep times than they used to. We know that there's a link between short sleep times and children being more hyperactive and acting out a little bit more, and some of my own research has shown that, with even daycare providers picking up on that children have a little bit more difficulty with memory and learning, and that it can be implicated in childhood accidents because children are a little bit clumsier if they haven't been getting enough sleep. We all know that when we're tired, we tend to trip more, or we don't pay attention to our environments quite so much. And children who are overtired, they're paradoxical. They're not like adults. When we get overtired, often what we do is we'll just crash. I crashed on the plane last night, for example. That's maybe not a good analogy. Anyway, but for children, when they get overtired, they get hyperstimulated, and they get more and more and more wound up, and they find it harder and harder to go to sleep. They fight sleep more, and they're more likely to wake up during the night. So they have kind of a paradoxical response to not getting enough sleep that it doesn't affect us in quite the same way as when we're adults. So it's important to think about that. So sleep's based on circadian rhythms and homeostatic processes. Now, circadian rhythms incorporate what we get from our environment. So I was just saying to Alan and Andrea before you all came that I flew back from Boston last night because I was at the American Sleep Association meetings, and I got in at midnight Vancouver time, which was 3 a.m. Boston time. So nonetheless, my circadian rhythm is completely out of whack because when the sun started to come into my bedroom at 5:30 this morning, my little body said, oh, it's time to wake up now. And that was 8:30 Boston time, but 5:30 Vancouver time. So the circadian rhythm incorporates those external cues from the environment, and that's how we regulate ourselves around the 24-hour clock. And it can get really thrown out if we travel or children travel and they're crossing time zones and things like that happen. Then we have what we call sleep pressure, which is what we call the homeostatic process. So if we get really tired, what we'll often do is take a nap. And that's sleep pressure that's built up over the course of the day. So we're feeling more and more fatigued. And sometimes on really bad days, if I haven't gotten enough sleep, I'll be sitting at my computer and I'll sort of nod off briefly and wake up and see a lot of A's across the screen because my finger got stuck on the A key. That would probably be better for that not to be on the internet. But anyway, so this homeostatic process is how our sleep pressure builds up through the day and makes us feel like we really, really need sleep. And if we don't get enough sleep, it just keeps getting stronger and stronger over the course of the day. And then we have the ultradian rhythms that we talk about, and that's where we have the stages of sleep, and we have what we call non-REM sleep and REM sleep. REM sleep is when your eyes flutter under your eyelids. It's called rapid eye movement sleep. So I'm just going to really briefly cover what that is because I think it's important for you to understand what's going on with your kids and what's going on with you too. So sleep cycles for children are about 60 minutes long. And I don't know how many of you in the audience have catnappers, but catnappers are children who sleep for maybe 20 or 30 minutes. They're not getting through a full sleep cycle. And when they don't get through a full sleep cycle, they don't get rested when they have those kinds of naps. So it's important to recognize that that's what a child's sleep cycle is. Our sleep cycles are about 90 minutes long when we're adults. Their first stage of sleep is what we call stage 1. And if any of you are rocking your children to sleep and you're trying to slide them into bed, the stage 1 sleep is where they're very easily aroused. So it looks like they're asleep, but they're not in a deep sleep. And as soon as you move them, their eyes pop open and they're wide awake. So that's why it's important to know about that stage 1 sleep. The stage 2 sleep mostly happens in the middle of the night, and it is when they're really asleep and you don't see a lot of body movement, you don't see eye movement, they're in bed and they're in a really deep sleep. And that is about 50% of total sleep time, and that happens later on. Stage 3 and 4 sleep is what often happens when children first go to bed at night. And that can often be a very deep and refreshing sleep for children too. And I don't know how you feel in the audience. Over the years, I've worked with lots of families who say to me, well, we put our baby down to sleep at around 7:30 or 8 o'clock, and for the first 3 hours or so, they don't wake up. And then as soon as we go to bed at 10 or 11 o'clock at night, they start waking up. What's that about? Well, they're in this deep sleep in the first part of the night, and they get that really deep, refreshing sleep, and they're not going through the sleep cycles in quite the same way. And it's when they start to move into different stages of sleep that they start to get into those phases where they start to wake up. So that's why you feel like you're just getting ready to go to bed, and this is when your child decides to start waking up. But this is part of the sleep cycles that they go through. So the rapid eye movement sleep, this is where they've got the rapid eye movement happening under their lids. There's intense brain activity, and this is when children dream. There's muscle twitches, and they can vocalize, but they're paralyzed, so they can't get up and move around when they're in their REM sleep, which is a good thing, because that's where they have nightmares, and you wouldn't want them acting out their nightmares if they could move around. So that's a good thing. It's about 25% of their sleep time by the time they're 5 years old, but when they're babies, it occupies about 50% of their sleep time. So they have a lot more REM sleep to begin with. And this is a time when they can often open their eyes and kind of vocalize. They're not moving in the bed, they're not getting up, but they can open their eyes and move their head around a bit and vocalize. And the problem with that and our baby monitors is often when they're young and they're in their REM sleep and they do that, parents think they're awake, they rush in because they can hear them on the baby monitor and pick them up because they think they're awake. But if they didn't do that and they left them, they would go back down into a deep sleep. So this is one of the downsides of having baby monitors, because it makes us totally aware of every little sound and movement that children make. And before we had baby monitors, you really have to signal your parents pretty loudly before they'd be even aware that you were kind of awake, right? So, okay, so what are some tired cues? The child gets more dependent and more whiny. They cry, and They may start to pull at their hair, or they might start to tug on their ear, and that can be a sign that they're very, very tired. They can become clumsy and accident-prone, as we talked about before, when they're overtired. But they can also start racing around and look like, oh, I'm ready to play. And so if they start looking like that, it's hard as a parent to interpret their cues and say, oh, this child is overtired and needs to go to sleep, because that's not the signals they're sending you. They're sending you signals of, wow, let's party. I'm ready for this, right? But you don't want to pick the signal up that way, because that's what they do when they're overtired. And they get fussy with food and drink, and sometimes they can behave a little aggressively. So they might hit you if you start to pick them up, or arch their back, or push off, or do things like that that are related to being overtired. So if we're dealing with newborns, they spend about 50% of their time in REM sleep, and that's where they start. And most of them are supposed to be sleeping about 15 to 16 hours a day, but it varies from 11 to 23 hours. Can you believe that, 23 hours? Do any of you know moms who said, I thought I'd be so busy with my baby after my baby was born, but all my baby does is sleep? You know what? Yeah? Was that what happened for you? No, but you knew moms like that. And you were probably thinking, rats, why did that happen for that mom and it's not happening for me? So there are variations between babies in terms of how long they sleep, but most babies really need that 14 to 15 hours when they're newborns. They're in the first few months of life. And in fact, right up till the first year of life, they're needing 14 to 15 hours. And you'd be amazed at the calls I get from parents with, I think of one parent in particular who had a 6-week-old, and she was sleeping 8.5 hours a day. And she started to get into what we call night terrors, where she would be screaming in her sleep and not awake. But it was because she was so sleep deprived, because she was getting so little sleep during the day, that she was starting to have these night terrors. Their sleep starts to become a little bit concentrated at night, but still not a lot when they're newborns. But maybe they'll have a period of 3 or 3.5 hours at night where they have what we call the longest sleep period. And that often happens by about 3 weeks of age. By the time they're 2 to 12 months old, I hope I found some good pictures for you. Yeah, it's a baby, isn't it? Yeah. They're starting to get a day-night pattern. So they're starting to have nighttime sleep and daytime sleep. They still need around 14 to 15 hours, but the range can be between 11 and 16.5. They should, by the time they're 6 months old, start to be consolidating their naps. So you should start to see 2 to 3 naps a day, 1 in the morning, 1 in the early afternoon, and then some kids still need that sort of quick nap later in the afternoon. If they're overtired at this stage, they do have more difficulty sleeping at night, and the cat nappers are a particular challenge, because they're the kids who go down for 20 minutes maybe at 10 o'clock in the morning, and then they'll go down for another 20 minutes maybe at noon, and then they'll go down for another 20 minutes at 2, and you feel like they're kind of napping all day, but they don't really get refreshed, and they don't really come out of it feeling relaxed and better about their sleep. So feeding and night waking is an important thing for us to talk about, because a lot of parents worry about night waking because they think their children are waking up because they're hungry. And newborns absolutely need to feed regularly at night, and children do right up to the time when they're 4 to 5 months old. They don't eat a lot. They have small amounts that they take in, and they digest their milk fairly quickly. So when they're getting milk feeds, they need to have those frequent feeds. As they get older, they can go for longer, and by the time they're 6 months old, they really should only need about maybe 1 feed to sort of tide them over for that 12-hour period at night. And that's why we talk about this notion of dream feeding. And dream feeding is where you actually go in and rouse your child at about 10 or 11 o'clock at night, just before you go to bed for the night, give your child a feed, and then put your child back to bed. And the hope is that if you're doing that dream feeding, you'll be reassured that your child is getting enough to eat, because if they went down at, say, 7:30 or 8, that dream feed's kind of 4 to 5 hours well, not 3 to 4 hours into the night, and then they can easily go for another 5 or 6 hours after you do the dream feed, so that they're able to get that consolidated nighttime sleep. So it can be a really useful technique to use. The reason we suggest dream feeding is because you're setting the agenda as the parent, not the child. So it's not the child that's giving you the cue and saying, I'm hungry now, I want you to come to feed me. It's you setting the agenda as the parent, and that helps to break that feeding-sleeping association, and I'm going to talk a little bit more about that. For early times, when babies are 0 to 4 years old, 4 months old, bear in mind I am a bit jet lagged, for babies that are 0 to 4 months old, a good thing to do with them is if they go to sleep on the breast when they're breastfeeding, to change their diapers before you put them down to go to sleep. It may not wake them completely, but it will rouse them a little, and it gives you a chance to put them down drowsy, so they have a chance to fall asleep on their own, instead of always falling asleep on you or in your arms or while they're breastfeeding. Now, having said that, I know there's kids who don't really fall asleep well on their own. And I've worked with a lot of families over the years where moms have told me that the only way those kids will go to sleep is on them. But there are ways to get around that particular problem, and we have found some good solutions to that. When your children are older, when they're between 5 and 12 months old, it's really a good practice not to feed any closer than 20 minutes before bedtime. And the reason for that is because you don't want children to associate eating with sleeping. Because if they do, what happens is when they come up into their light sleep states at night, they think, oh, I don't have anybody feeding me, so even though I didn't feed to sleep, I don't know how to get back to sleep without being fed first. And so they will signal you and have you come in, because that's the only way they know to get back to sleep. Sleep routines that include a story or a song are really important, and you can't start those too early. And there's some really good research out there that shows that children who are read a story who go to sleep, and the librarians were thrilled when I told them this, have better sleep and longer sleep than children who don't get read stories. So that's a really good part of a bedtime routine. So for toddlers and preschoolers, sleep requirements are partly determined by age and development, but also partly determined by family schedules. Yes, that's a little boy with a truck, isn't it? Yes. Total sleep is about 13 hours by 2 and about 12 hours by 3 to 4 years of age. The majority of their sleep should be at night, so it should be around 11 to 12 hours at night in an ideal world. The average 1 to 2-year-old has 1 to 2 naps lasting about 1.5 to 2 hours. Often I'll find families saying to me, oh, my child's decided to give up the morning nap, and the child's maybe a year old. No, the child's just going through a period where they're kind of resisting that morning nap, but mostly they're not ready to give up a morning nap until they're about 18 months old. So if you just go with the flow and give that morning nap up, you're going to find likely that that little person ends up getting a bit overtired and a bit sleep deprived. Unless they're having really long afternoon naps, and I guess if you have maybe a 3 or 4 hour afternoon nap, you might make up for losing the morning nap early. And by 5 years of age, most children give up their afternoon naps. They're ready to do it by then. But by 5 years of age, children still need 10 to 12 hours of sleep, so they need to be getting that sleep at night. So if they're going down for really late sleeps, so they're not going down until after 9 or 10 o'clock at night, they're not going to be getting that sleep that they need, and it will have implications for them. So all infants and young children have periods of wakefulness at night. For example, I was just in Boston on the sleep conference, so I was there for 5 days. And I come up into light sleep states at night just like we all do. But it's a strange place, and I'm in a hotel room that I don't recognize. Often when I come up into that light sleep state at night, I'll open my eyes and look around and think, where am I? But because I'm an adult and work it out, I'll think, oh, I'm in Boston, I need to go back to sleep. And I'll go back to sleep. Children who come up into these light sleep states, if they end up waking up somewhere different than they were when they went to sleep, they don't do that. And they startle awake and come up into a full wake state because they're thinking, I don't recognize where I am, and I can't go back to sleep. Or if they don't have the conditions they had when they went to sleep, they will wake themselves up totally and signal for their parents. So if you're having a child that's waking hourly during the night, they're going into those periods of wakefulness 7 times a night, and they're waking themselves up fully rather than going back down into a sleep state. So we really don't want that happening for you or for your child, because it's not good for them either. So what are some really good strategies? Really consistent daytime and nighttime routines. I notice we've got a little person in the room who's wearing pink, who's clearly a very social little person. She really likes people, and she really likes to interact. Often little babies that are like that have a lot of trouble shutting down. They really fight sleep. They don't want to go to sleep. They want to be part of the party. And if they don't have consistent bedtime and nap time routines, they don't know what's coming. So the consistent bedtime and nap time routines really say to them, recognize this. This is when you're about to go to sleep. And you need to start to relax into this and feel like it's okay for you to let yourself go and let yourself go to sleep. Consistent routines are really important too, because they recognize that and they also know what's coming. So I know it's really boring for parents, but the same song, the same story, brushing their teeth at the same time, washing their mouths with a cloth if they're just starting to get teeth and you're not ready to brush, but you want to scrub their mouths out a little bit. Any of those kinds of things as part of the regular routine are really helpful. A lot of parents bath their children in the evening, and I'll often say to parents, what's the reaction to the bath? If they're in the tub and they're winging things and they're throwing water and they're getting really, really stimulated, it may not be the best part of a bedtime routine to be using. Because if you're stimulating them, it's going to be that much harder for them to settle down and relax and go to sleep. So for children who find bath time really stimulating, I'll often suggest that you move it to the morning rather than have it as part of the nighttime routine. You really want to use bed for sleep and not for play or for punishment. So if you're going to do timeouts, it's better not to send children to bed for their timeout. It's better to have just a place in a room where it's part of their normal activities. And you really want to limit caffeine intake after noon. And I know parents sometimes look at me a bit surprised when I talk about caffeine intake, but I'll often see babies with bottles that might have a little bit of a carbonated drink in them or something like that. And even though it's not a cola, a lot of carbonated drinks do have caffeine in them, even the clear carbonated drinks like Mountain Dew and things like that. So it is really important to avoid those caffeinated substances after about noon. Stimulating play. So one mom told me that she thought she and her partner were on side for the working on the sleep problem, but he'd come home from work and he'd really want to play with the baby at night, and there'd be the tossing up in the air and the running around and the really wild games, and the baby would be completely stimulated. So that they need to have a conversation about that around what's the appropriate kinds of things to do in the evening and what's going to overstimulate your baby. And a lot of parents will tell me that they use video games as part of the bedtime routine, and you really don't want to do that because that overstimulates your children too, and they're getting screen time, which doesn't help them relax into sleep. So you want to avoid that as part of the sleep routine. For older children, you want to make sure that there's no computers, TVs, or cell phones in bedrooms, because if they wake up during the night and you're not aware that they're awake, they'll just wake up and play on their computers or play with their cell phones. They might be texting each other or watch TV, and that's not going to help them with their sleep patterns. It's good to keep rooms cool and dark with noise to a minimum. And for really light sleepers, what I'll often recommend for parents that they do is go and get a noise machine or leave a radio in the room off the station so it's got hiss in the background, because that can really help those light sleepers sleep a little better. And a special toy or a lovey can help children settle. If you're going to use a lovey, I recommend that you have backup, because if your child gets really used to going to sleep with one toy or one lovey and you lose it, it can cause inordinate amounts of trauma. So it's better to have 2 of them. Okay, so what is a sleep problem? We see it in about 20 to 30% of children, but really parents define whether children have sleep problems or not. And I say that because I don't hear from parents who really want to have a family bed and have co-sleeping with their children, and that's their philosophy, and that's how they want to manage their parenting and their children's lives. They're perfectly happy with night waking in the family bed, and they're not the people who contact me. I get contacted by parents who are only co-sleeping with their children because they can't figure out any other way to help them sleep, and they don't really want to co-sleep with their children, and actually they get a bit frustrated with the co-sleeping. So it's really up to the parent to decide whether they think their child has a sleep problem or not. But we usually think there's a sleep problem when sleep time is shorter than we would consider adequate for age-appropriate norms, or when you're seeing signs during the day that your child is grumpy or starting to melt down later on in the day. So maybe they're really happy in the morning and they're really social, but by 4 or 5 o'clock in the afternoon they're kind of beside themselves and they don't know what to do with themselves. That's an indication that their sleep time isn't really enough. They're not going to complain about their sleep patterns. They don't know how to do that. So they're just going to go with the flow. So it's really important for you as parents to help them set limits and boundaries around their sleep. Some parents will contact me and say, well, my kid is waking up at 6 o'clock in the morning. Can't you fix that? And I'll say, well, no. Your child is probably a lark, and I'm a lark. I tend to wake up at 6 o'clock in the morning. Unfortunately for my husband, I also tend to do that on weekends. And it's just how my sleep cycles work, and it's really hard for me to train myself not to do that. So if you have a child who's a lark, that's just part of their persona, and it's just something you're get used to as a parent, and you're probably going to have to make your bedtime a little earlier if they're always getting up at 6 o'clock in the morning. So usually parents define the difference between good sleepers and poor sleepers as kids who can't sleep through the night, who can't self-soothe and get themselves back to sleep on their own. And I've already intimated that children need the same conditions at night to go back to sleep when they come up into those light sleep states as they had when they went to sleep. So if you were present when they went to sleep, they're not going to be able to get back down into that deep sleep state without you being there. And we're going to talk a little bit about the different kinds of sleep problems. So there's the dyssomnias and the parasomnias. So this is what we call a behavioral sleep problem. The fancy name for it is dyssomnias. And what it is when children have trouble falling asleep or staying asleep. And we define it usually as waking 2 or more times per night or more than 20 minutes per night for longer than 2 months, or taking more than 20 minutes to settle. Sleep routines are really important, but you don't want a sleep routine that goes on for an hour or an hour and a half. You want to be able to set limits around the sleep routine, and you don't want your child to be directing the sleep routine and saying, one more story, one more song, one more drink. You want to have really clear guidelines around what that sleep routine is going to be. Hi. Common causes are sleep onset associations, setting problems, and we'll talk about that, but also sleep apnea syndrome, and we want to make sure that we rule that out before we start trying to manage a behavioral sleep problem. Some children grow out of sleep problems and they end up being really good sleepers, but many children do not, and we don't want sleep problems persisting into school age and adolescence. I was at a presentation at the conference, and one of the presenters was saying that her research area is dealing with adolescents with really high anxiety levels. And she was saying that when they had a sleep intervention and they were going to have an intervention around the anxiety, and when they had the sleep intervention for the adolescents with high anxiety levels, it ended up bringing the anxiety levels down so much they didn't need the anxiety intervention. And when I was at the session that was talking about brain function and what happens with the brain, what they showed is there's different parts of the brain that light up when you've got sleep deprivation versus not sleep deprivation. And the parts that are inhibited by sleep deprivation are our ability to regulate our emotions. So we're more reactive. We have a harder time regulating our emotions if we're sleep deprived. But the part that gets the part that has more difficulty too when you're sleep deprived is the part of the brain that also puts down memory. So our short-term memory and our memory consolidation gets affected as well if we're sleep deprived. And that's why they think we're seeing problems around cognition and learning for children who are sleep deprived because they're not consolidating their memories in the same way. So we've really talked about this already. You don't want them going to sleep in your arms. You don't want them feeding to sleep. You don't want to be lying in bed with them, because those are all things that create conditions that your child can't replicate if they wake up during the night and they're going to need you to come and deal with the problem. I've already talked about usually not needing feeding after they're older than 6 months old, but the only caveat I would say to that is I often talk with families where the children are not breastfeeding well in the daytime who are older, and that's because they often are at a stage where really easily, and if you're feeding them in places where there's lots going on, they'll continuously pull off the breast and start looking around, and they won't eat well during the day. And if they don't eat well during the day, when are they going to make up for their calorie deficit? At night. So that's when they're going to be wanting to eat all the time. So if you're having a baby that isn't eating well during the day, is constantly pulling off the breast, not really doing well with the feeding, it's better to take them to a very, very dark, quiet place to feed them so there's minimal distraction, so they're not having to make up for at night what they're not getting in the daytime. And they usually cry because they haven't learned how to self-soothe to go to sleep, and that is a really important skill for your child to learn. I noticed earlier one of you was playing peekaboo with a child in the audience. And you can play peekaboo when children get older because they have object permanency. They know if you go behind the blanket, you haven't disappeared off the planet. When they're younger, if you went behind the blanket, that would make them cry. They would get really upset because they would think you disappeared. But when you play peekaboo when they're older, they know you're hiding behind the blanket, and they laugh when you come out from behind the blanket. That's what we call object permanency. As they get older, they also start to develop the building blocks for self-soothing. If we don't give them opportunities to learn how to self-soothe, if we intervene every time that they get a little upset or start to get a little frustrated, they don't start to learn those skills, and then they don't have those building blocks in place for when they get older and they need them. So that's really important. So we already talked about a lot of this. You want to avoid reactive co-sleeping. And one thing you can do is use what we call controlled comforting. And that is where you're not leaving your child on your child's own and saying, okay, I'm closing the door and saying, right, you've just got to learn how to self-soothe and figure it out. No. What you're doing with controlled comforting is you're putting your child down in their bed. You're saying, good night, it's time to go to sleep now. Give them a kiss. Leave the room and wait to see what happens. If they don't signal and they don't cry for you, good. They're self-soothing, they're going to sleep on their own. If they start to cry for you and they're signaling, you can go back into the room after a minute or so, check that they're okay, say it's time to go to sleep now, stay with them for a little while, make sure they haven't got their foot caught in the crib bar, or there's nothing major going on, and then leave them again for a while and wait to see if they can start to self-soothe and start to calm themselves to sleep. Gradually, you stay out of the room for longer periods of time. So 2 minutes, 4 minutes, 6 minutes, 8 minutes, till you get up to 10 minutes. And your hope is that in one of those times that you're out of the room, your child will be able to go to sleep on their own. It works very well, and a lot of parents will say to me, well, doesn't this cause problems for the child later in life? Isn't this going to undermine their attachment? I was talking with Jody Mindell at the sleep conference, who's a sleep researcher who's been in the area of children's sleep for about 30 years. And they just did a meta-analysis of all of the studies that have come out around kids' sleep and behavioral sleep interventions and any impact those may have had on attachment or on psychological development. And they can find no association between undermining attachment and any psychological problems with development. So I'm really looking forward to that being published, because I think there's a lot of myths out there around what can happen around crying and some of these techniques, and this will go a long way to helping us understand that we're not seeing those kinds of effects. Limit-setting problems happen in older children, and this is where they're constantly asking you to stay in the room with them, constantly asking you to come back and give them something to eat or drink, or lie down with them, or tell them another story. you really need to set consistent bedtimes for those children and give them a really clear message that you are not going to stay with them till they go to sleep. And what I have found works really well for these kids is to avoid lying in bed with them. Tell your child you have to leave the room for a few minutes because you've got a chore to do. Time how long you're out of the room, and make sure you go back, check on your child after those few minutes, and see how they're doing. Make those times that you're out of the room longer and longer to run your chore. And the idea is that hopefully your child will fall asleep during one of those times when you're out of the room. And I did this with a family the other day that was having a lot of problems with their older child going to sleep. And the mom said after 2 days, it worked. There was no more of that going on. And the other thing you can use if your child's a little bit more resistant to that approach is the sticker system, if they're old enough to understand it. And what you do there is you reward them with a sticker for every night that they can fall asleep on their own. But then after 5 nights, what you do is you do a little treat. You don't have to go buy them something. It can be if they really like to go to the park with you, or if they really like to go to on a particular walk or something. After those 5 days, you reward them with that treat, and then that's a reinforcement for them, because often for young children the stickers aren't enough. After 5 days of stickers, it's like, so what else is new? What have you done for me lately? So that can be good. We use the bears to try and work out, are we dealing with an underlying problem that's more significant than a behavioral problem? And we're interested in excessive daytime sleepiness, a lot of difficulties with snoring or breathing at night, and whether there's anything we're seeing at night that would indicate there's something else going on than a behavioral sleep problem. So obstructive sleep apnea is something we do have to pay attention to. It's not very common in young children. It's far more common in preschoolers, but it can happen. And that's when a child is really having difficulty with an obstructed. So if you notice your child gasping at night, or stopping breathing, or seeming like they're choking, or you're hearing really loud snoring from your child, these are things you need to get checked out, because that's not normal, and it can indicate that there's some airway obstruction happening, and that's what's waking your child up at night. It's not that they have a behavioral sleep problem. They need to see a pediatric sleep clinic or a specialist and be assessed. And often they'll find in older children that these kids need a tonsillectomy and an adenoidectomy, because the tissue is often so enlarged that it actually obstructs the airway, and the removal of that tissue can actually help solve the problem. So that's something to pay attention to. It can be associated with chronic nose infections, ear infections, sore throats, bad breath, or frequent colds. So if your child's got some of those things going on, it's important to pay attention to that. We don't want any underlying medical problems happening if we're trying to treat a sleep problem. So we don't want any reflux that isn't being managed. We don't want ear infections that we're not treating. We don't want allergies that aren't being looked after. We don't want eczema where that's waking the child up at night because they're really, really itchy. We want to rule out those underlying problems that could be going on and get treatment for those before we start to treat it as a behavioral sleep problem, and that's really, really important. Parasomnias happen after sleep onset, and these are disorders of waking or partial waking with transitions between sleep stages, and they're most common in preschoolers and early school-age children. A lot of children grow out of them, but we're more likely to see these in children who have disrupted sleep from behavioral sleep problems and are sleep deprived. So the example I gave earlier, the 6-week-old, is an example of that. So the common types are confusional arousal. So that can happen in the first few hours after sleep. And that's when a child mumbles or mutters or grimaces, doesn't remember it the next day, might just have it happening for 2 to 10 minutes, but will go back down to sleep independently. So as parents, it's better for us not to get alarmed by that, let them go back down into that deep sleep. Sleepwalking occurs in 1 to 15% of children. It's more common between 4 and 8 years. What you want to do with a sleepwalker is direct them back to their bed don't wake them up because they're sound asleep, they're not awake. It's not going to help you to wake them up, but you do want to make sure they're safe. So if you've got a child that's sleepwalking and there's stairs in your household or there's windows that they could potentially push a screen out, you want to secure those things so that they can't wake up in the night and sleepwalk without you knowing and potentially fall down the stairs or fall through a window. So gates can be really useful for that. They don't remember the episode the next day, so it's you who's going to get more upset by this rather than your child. The same thing is true of night terrors. Children do not remember night terrors. They're in stage 4 sleep. They scream, they may sit up in bed, they may even open their eyes, not awake. If you try and comfort them, they're not even aware that you're there. And if you try and pick them up or rock them or hold them, often they'll flail or hit you because they're asleep and they don't recognize that you're there. So the best thing to do for those children is just let them go back down into their deep sleep on their own and just make sure they're okay, they're safe, and there's nothing going on. It really doesn't help to try and pick them up and try and console them because, as I said, they don't know you're there and they'll react against that and often kick out. Nightmares, they are aware that those are going on. It happens in 25 to 50% of children aged 3 to 6. It's often happening if there's other stressors going on in their lives or they're worried about other things. They may see monsters in the night. They may dream of bad things happening to them. They may dream that things aren't going well for them or there's something bad happening. The best thing to do is not to overreact to their dreams. You don't want to make a really big deal out of them because for some children then that really gives the dream a lot of importance. But you do want to reassure them and tell them they're okay and you're there and nothing bad is going to happen to them. And maybe even deconstruct the dreams with them and try and get them to think about the dream in a more positive way so you can introduce positive images into it if it's a recurrent dream and they're really starting to have some problems with it. So we've already talked about the effects. Toddlers, this is some of my research that we've done. Daycare providers indicated that toddlers that had more difficulty settling for naps were more depressed, more aggressive, and more withdrawn at daycare. They weren't adjusting to daycare as well. This is 1 to 3-year-olds. If they're not adjusting to daycare because they're having difficulty settling for naps and they're having difficulty sleep, you can imagine what it's going to be like by the time they're school-aged or they're in preschool when they're older. They're more likely to be overweight if they have short sleep periods. There's more and more studies coming out now that link obesity to short sleep. And the reason that they're linking it is because they think it's interfering with the secretion of hormones during the night and they're getting disrupted, and so their normal appetite suppressants aren't operating, and so they don't have normal appetite regulation. There was also some evidence at the sleep conference I was at that it affects their regulation of insulin and their ability to secrete insulin during the night. So that's the other thing that's going on with that. Parents with disturbed sleep are more likely to be depressed. They have more fatigue. They have more potential for accidents. I was reading one of the papers that was presented at the conference, and it showed that mothers that were sleep deprived, especially in the early postpartum period, had way more close calls on the road than mothers who weren't. And there's a guy who just got his thesis published. I was the external examiner for the thesis, an Australian researcher, and he showed that fathers had more accidents at work and had more close calls with road accidents when they were sleep deprived around the sleep of their children. So this is not a minor thing. And when we recruited the families for our Rocky Sleep study, we did a baseline measure of depression. We excluded any families with a diagnosis of depression. When we used the cutoff score on the measure for depressed mood, 80% of our mothers and fathers scored above that cutoff score. When we used the cutoff score for clinical depression, 43% of our families were above the cutoff score for clinical depression. This is not a good thing. It doesn't help parenting if a parent's depressed. It's hard to problem solve. It's hard to engage with your child. It's hard to feel like you are there and present for your child. So it's really something we need to pay attention to. We're also doing an analysis right now of a longitudinal database from Quebec, and what that's showing is mothers who jump in and try and help their children right away, who they call overprotective in this study, are more likely to have preschoolers with sleep problems and separation anxiety and shyness. And that's, again, not giving an opportunity for the self-regulation to develop. Moms are trying to fix it, and they're jumping in to try and make it better, and children are not learning how to self-regulate. We know that moves, teething, illness, and vacations can interrupt sleep and cause problems with sleep. But if you use the controlled comforting technique and teach your children to self-soothe, they'll go to sleep very quickly on their own once the move or the sleep disruption from the teething or the illness gets sorted out. And you'll find yourself getting back on track quite quickly. You need to look after yourself if you're trying to deal with sleep problems, because it's actually very stressful as a parent to try and manage a sleep problem. And you need to make sure your partner or your support system is on side. So, we can all make it better if we can figure out how to deal with this stuff, and I hope that this has been helpful for giving you some suggestions about what to do. And I'm happy for us to have a conversation. So thanks for your time.
You were saying that you often are experiencing families that make an active decision to co-sleep. You don't see them very much, but parents that make a decision to co-sleep sort of reactively. That those are some of the problems.
Yeah.
So if the child, regardless of what their philosophies to co-sleep, is still waking, do you still see some of these effects of the
fragmented sleep?
Yeah, that's the, so, you know, and then also, is it just the frame of mind, you know, are the parents, they're still not getting much sleep. We're sort of right in between. At first, we really thought it was very important to co-sleep. Then our 13-month-old, we're not so sure that it's that important anymore. So we're really on a crossroads. And
Yeah.
I'm just wondering.
It's a really, really good question. And I think it's hard. There hasn't been a lot of definitive work done on it, which is part of my hesitation with answering it. I think if you're getting to a place where you're starting to wonder about the co-sleeping, it is really important to re-examine it. Because if you're starting to feel like you're not getting adequate sleep at night, and sometimes the trouble when they get older too is they're perpendicular sleepers. They sleep perpendicular to their parents, and so they start kicking you in the ribs or in the stomach or headbutting you in the middle of the night because that's where they're sleeping in the bed, and that doesn't make for a restful night's sleep for anybody. So I think it is really important at that point to, it's okay, I don't mind if there's crying. Okay. It's really important at that point to kind of re-examine what you're doing and think about whether that's really going to, work for you or not. Because I think it does start to have an effect on parenting if you're waking up frequently during the night and you're feeling sleep deprived. It may not be so bad for your child because when they're getting the fragmented sleep, they are, but because they're in bed with you, they don't tend to wake and signal and be awake for as long.
Yeah, he'll wake up and fall back asleep within 5 minutes.
Right, and you're not.
Not really.
Yeah, so this ends up inducing insomnia in the parents, and that's not a good situation. So my advice would be for you to think about you and your partner and how important it is for you to get your sleep and sort of re-examine the whole co-sleeping thing at this point. Is that helpful? Okay, good. Okay, yeah.
I've got a nearly 3-year-old, and I was pretty good at doing I did the same thing, the sleeping thing, with her. She was like 9 months,
Yeah.
like settle and all that.
Yeah.
But she falls asleep really well with routine. And during the night she'll wake up, but every second night about like this.
Right.
And I just say, just come and crawl into her bus. But then you're right, like I don't. Like last night I was awake for 3 hours, straight went back to sleep, but she was kicking me and
Yeah.
whatever. So what should I do when she wakes up when she's this age during the night? Should I don't know.
Yep, that's a really good question. So what I would do is she's old enough to understand what's going on, so I'd explain to her that at night when she wakes up, it's really important for her to be a big girl and sleep in her own bed. And I would take her back to her bed and tell her it's time for her to go back to sleep in her bed. If you do that on a regular basis, she will stop waking up and coming into your bed in the night, because that's sort of the reward that's happening for her. She gets to snuggle up with mom and dad and have this really kind of fun sleep, but you're not getting any sleep. And the sticker can be really good for a 3-year-old, you know, using the sticker routine and saying, wow, for every night you can stay in bed all night long. Mommy is going to put a sticker up there for you, and then after, you know, 3 days or 4 days, we're going to go do something really special.
And of course, sometimes we'll ask milk, not give us some more milk. But
That-
that should come out.
yeah, cut out the milk thing. Yeah, better not to go
When
there.
she was younger, so I didn't want to give that up.
Yeah.
She's stopping it when
Yeah,
she's fine.
yeah, cut out the milk.
Just be strong, like we did when she was younger.
Yes, be strong. You can do it. Yeah.
Water. You know, like for my concern is my child is a very persistent little boy. He's probably going to cry for a while when we do this.
Yeah.
I get thirsty during the night. I always have a glass of water on the side. Like, is it reasonable to come in with a little water if you feel that when they're crying?
I think you have to think a little bit about what kids normally do. And most kids normally don't wake up in the middle of the night looking for a glass of water, right? I mean, they don't.
Right, but if he's crying, you know, if he's actively, that's more my concern rather than waking up. I'm sure it's not because he wants water.
Yeah.
But,
So I guess you have to think about, if I do this, is this going to end up rewarding my little person for, you know, waking up during the night? Because even if you're only giving water, which is not as good as milk, and they probably aren't going to get as excited about that, you still are rewarding them with your presence in the room, bringing the glass in, giving them a drink, probably hanging out for a little while because he's not going to want to go to sleep right away if you're there giving him water. So it really is better to kind of not go there, and really, if you're going to cut it off, cut it off. Yeah. Because you are sort of giving mixed signals too, and that's why I was saying why it's so important to be consistent around bedtime and around sleep time, because children are young enough that they don't really understand why it's different at 1 o'clock in the morning than it is at 6 o'clock in the morning or during their nap. They don't get that. But they really do respond well to being absolutely consistent with what you're doing around their sleep, because it doesn't take them long to say, oh, okay, Mom and Dad are really serious about this, and this is going to be the new regimen, and I guess I better get used to it. And persistence is tricky.
sometimes is it better to have the father be a bit more, you know, when you see these intervals? Because I find that he reserves a special sort of fussiness for his mom.
Yeah.
So,
I will often recommend that dads get involved, particularly if there's still breastfeeding going on.
Yeah.
Because what happens in situations like that is, as the mom, if you go into the room and your baby or your older infant can smell your breast milk, and you're there going, oh, it's okay, go to sleep now, they just get really mad, you know, because you're in the room and they can smell the breast milk and they're saying, well, you're in here, why aren't you feeding me? But when Dad goes in, they don't expect Dad to feed them. So often they respond a lot better. If Dad goes in and says, no, it's time to go to sleep now, see you in a while, night, they take that much better. Got to be on the same page to do that, though. Yeah.
I have a 3-year-old, and she's at the stage where she's imagining things, and she would story tell before bedtime.
Mm-hmm.
So my question is, how do you stop that, and how do you manage that if, for example, especially at naps during the day, she does that as well. So sometimes she won't nap at all and would go like 12 hours straight without napping and still sleep late at night. So because she's overly active as well and have a very active imagination.
Yeah. It's hard because I think you're giving me a classic example of a child that has a really hard time shutting down. And, you know, those are usually the kids that I end up hearing from families. I'll often ask a question to the family, is your child really intense? And there'll be a pause at the other end of the phone, and they'll say, well, what do you mean by intense? And I'll say, well, I mean somebody who really likes people, who really likes to be in the middle of the action, who you would sort of describe as a party animal. And a lot of the families will say, yes, that is exactly what my child is like. And those are the children that find it the most challenging around sleep. And they're the children that rely on parents the most for setting limits around sleep. It's so important for you to do that for them, because if you don't set the limits for them, they can't figure out how to do it themselves. So I'm not sure what you mean when you say she's into storytelling. Are you saying she wants repeated books over and over and she's not settling to sleep? Or
That's easier to manage if she's asking something, but if she's going on and on by herself, I mean, I don't want to shut her up.
Oh, I see. So she's telling you the story. Got it. Okay. Okay, yes, you don't want to shut your child down. I totally understand that. So a good thing to do would be to say, you know, this is a great story, and I would really like to hear more about this after you wake up from your nap. We'll have that to look forward to. So let's just go to sleep now, and you think about that story as you're falling asleep, and when we see each other after your nap, you can carry on and tell me more about that story.
So is nap still important around that age?
Yeah, my suspicion is that the reason you're having so much trouble getting her to go to sleep at night is because she's overtired. If she's going, yeah. So it's what I talked about. It's that paradoxical reaction in children where if they're sleep deprived, they have more trouble going to sleep. So it is really important for her to have that afternoon nap. And, you know, even if to begin with she doesn't actually go to sleep and it's only a quiet time in her bed, you're giving her an opportunity to fall asleep, and you're giving her an opportunity to rest and kind of relax in the afternoon, and that can promote sleep. So even if you start with that, you can often find that she'll start to go to sleep during that time, but you've got to be really, yes, thank you, really consistent and really insist that she has that quiet time, and hope that that will morph into a nap in the afternoon and not just quiet time. Yeah, is that helpful?
Yeah, it is helpful, but sometimes when she naps, she goes like 3 hours straight.
For a nap?
Yeah, for a nap.
Okay.
When she does take a nap, so
Right.
like twice or thrice a week. So it's not really that consistent. It depends on, you know, probably the amount of activity that she had during the day,
Yeah.
which is not really that consistent.
Yeah. Well, you know, it could be children give up their afternoon naps at different stages. So one thing you might want to think about is whether she's an every other day napper. So what you do then is you would have her nap every second day. Put her down for her nap. If she's going so long for her nap that she's waking up really late in the afternoon and that's interfering with her bedtime, then you need to think about that. And although I don't normally say that you should think about waking up sleeping children, if she's going for 3 hours and that's going to push her out till 4 or 5 o'clock in the afternoon, I would tend to wake her up after 2 hours of her nap, because it's only going to postpone her bedtime at night, and it's going to mean you're putting her down a lot later, which is not good for her either. They really should be getting down to bed before 9 o'clock, ideally around 8. Yeah. So, does that help?
Yes, it's helpful. But you know, she can go straight like 12 hours without napping one day, and then one day she would take naps for like 3 hours straight, and then go to bed, of course, late at night.
Right.
Then go to sleep like only for 9 hours.
Right.
That night. So
Right.
it's really inconsistent, and I don't know what to do because she has this schedule I have for each morning.
Right.
And sometimes we miss, you know, some of the activities that I have line up for her. So
Yes.
and she's going to preschool like in September.
Right.
I'm trying to wake her up at the same time each morning. It doesn't happen. It started actually during the winter months because we don't really like go out every day. So when she's at home and not doing, you know, as much activity, then she would take a nap on that day.
Right.
And that's what happened.
So you gave up the naps on the days when she had activities. I really want you to think carefully about that. I know that we've created a society where we say it's really important for children to get out and get stimulated and have all these activities going on. But I think one of the things we have to think about is whether that ends up happening at the to the detriment of their sleep. And what you're describing is exactly what happens when children get overtired. They don't sleep well during the night. They don't sleep as long during the night. Their sleep ends up getting all over the place. It's not consistent. So you might really want to think about whether you want to institute an every other day nap, but if you do that, you have to be really religious about making sure you're there for her nap times. And you can't let the activities interfere with her ability to have her nap, okay? That's really, really important. Yeah. Yeah.
Is there an ideal time for bedtime and wake-up time?
Your little one's 7.5 months? Yeah, so I would say for a 7.5-month-old, you really want to be settling them to sleep around 7 in the evening, no later than that. Because they get that really nice deep sleep at the beginning of the night, and that's really important sleep for them. Maybe 7:30, but certainly no later than that. As far as the wake-up time is concerned, you have to look at the whole 24 hours. So you have to look at the 24-hour clock and what happens for them. Is your little person a cat napper? Yeah, I had a feeling that was the case. So does she sleep if you take her out for walks? Okay. So what I would recommend you start doing is, it's good weather right now, put her in her buggy, pick your time in the morning, take her out for an hour walk. It's good for your exercise. And try and get her on that pattern. An hour to an hour and a half in the morning, an hour in the afternoon. Once you've got her patterned, so she's doing that regular nap at those times of day in the stroller or in the carriage, then you can transition her back into bed for those naps. And she will likely sleep much better for you because she'll get patterned into that routine of sleeping those times during the day. If she's not napping well during the day, she knows I'm talking about her, doesn't she? She's over there going, uh-oh, the sleep lady's talking about me. Yes, you have that look. Are you worried? Yes. It's not good, is it? So that's really, really important to get those naps regulated, and then you're probably going to find that she's going to sleep better for you at night. And if you can get her down by 7:30 at the latest, she'll probably sleep through till quite late in the morning, 6:30, 7, something like that. Yeah. She looks like she's getting tired already. Yeah. Yeah.
I just wanted to clarify something about the napping. My daughter just turned 3. Mm-hmm. She was actually in the sleep study when she was
in Rocky Sleep? All right. Yay!
And so we find that on the days that she does have a nap, it is really difficult to get her down at night.
Right.
But if we keep her up 7 o'clock, no problem. We do our routine and she'll fall asleep on her own. So is it better to have that consolidated sleep at night or...
Yeah, it is.
So, because my husband's very big on trying to get her to nap in the afternoon, and I know that we're going to suffer at night.
Yeah.
Because she's sometimes up until 11 o'clock.
Oh, my goodness.
She just has a 20-minute nap.
Right.
So it really screws her up.
Yeah. Well, you need to base it on what's going on with your child. So if the nap is really messing her up as far as her nighttime sleep is concerned, she may be a child who could do well on that 12, and she's getting her 12 hours. If she's going to bed at 7 and getting up at 7:30. Yeah, so she's getting 12 and a half hours actually. So she's decided to consolidate her sleep into nighttime sleep, and she's really not needing that nap now.
Okay.
So that's okay. If she doesn't need it, it's okay.
Okay, yeah, because her mood does deteriorate in the afternoon, which is where he feels like she would improve with the nap. But
Right.
we see it consistently where, if she does get that sleep during the day, she just can't get down at night.
Yeah. So life is a series of trade-offs, isn't it? So she probably is going to be a little crankier in the afternoon because that's a long time for her to go without sleep. But if that's going to really interfere with her nighttime sleep, then it makes sense. And the important thing is whether she's getting sleep within her norms or not, and she is, if she can sleep that long at night. So that's really good.
Well, she does. There are still issues with her waking up in the middle of the night. She'll try and fall into bed. I have another 7-month-old.
Wow.
So he's sleeping now. He doesn't have as many issues, but he was sick in the beginning with frequent colds, which really messed things up.
Yeah.
So I've just given up and I'm co-sleeping with him. I'm quite happy with that because it works for us.
Okay, that's fair enough.
So my husband sleeps in a different bedroom, and my daughter will crawl into bed with him. He's not so strong at 4 in the morning to say that.
Okay.
There's that issue happening.
Yeah, well, you guys probably need to have a conversation about that because it's really not good for her to have that fragmented sleep. And she's a preschooler now, so she can sort of make up for it if she needs to. But when she starts to go to school, it's not going to be so easy. And if she doesn't grow out of this habit, the other thing that can happen to them is they can end up with that night waking going on, but they can get old enough that they don't crawl into bed with you anymore. And they just play in their rooms, and you're not even aware they're awake. And so then you've got this problem with fragmented sleep going on, but as a parent, you don't really even know because they're not signaling you. So you don't really want that happening for her.
I like the idea of the stickers. I think we'll try that.
Yeah. Yeah, I think you'll find that works pretty well.
Okay, thank you.
Get your husband on side, though.
Yes.
He has to be strong.
Yep.
Someone else that has.
I just want to comment.
Yeah.
As for, so our son is 13 months, but he's been sleeping in the bed pretty much from day one. We do have a crib, which he did sleep in when he was about 3 months old, but there was a switch where we traveled and we could only sleep with him, and from then on, that's how it's been.
Mm-hmm.
So at what point do you try to transition to a big bed?
A big bed. It varies from family to family. A lot of families wait until their children are, say, between 2 and 3. It depends on if another child comes along. Sometimes they'll transition the older child to a big bed sooner if they've got a second child that's in a crib. And often that can happen around the whole conversation about you're the big kid now and you're the older brother or sister and now we're going to move into a big bed because... So it depends a little on the family dynamic. If you're going to start trying to do this sleep work, it's better for them to be in a crib because then they can't get out of the crib and come out of the room. It's not so easy for them to do that. So if you're worried about crawling over the side of the crib, then it's better to leave the... Does that happen with... Oh, you don't know.
Well, we don't know,
Yeah.
but he's extremely active and very, like, the doctor recently said he's walking at 18 months old, he's only 13 months, and he's very active, like you said, and intense.
Yeah.
He fits that perfectly.
Yeah. So try the crib thing. If it looks like he's trying to climb over the top of the crib or you're worried he's going to injure himself, you can leave the side down and put something on the floor so that if he manages to crawl out of the crib, he's not going to hurt himself. But try it with the side up to start off with and just see how that goes. He's going to pull himself up in the crib and he's going to complain quite bitterly. But if he's capable of getting himself back down again, you don't have to worry about that too much. You don't always have to go in and lie back down if he can do it himself.
He tends to also, when he's in the bed, when he does wake up, he doesn't always need to be breastfed back to sleep. Sometimes it's enough for me to just sing a lullaby and maybe pat him on the bum or something, and then he's okay. But he also, sometimes he's a very squirmy sleeper and sleeps on his stomach all curled up, often sort of with a pillow kind of by him. So I'm wondering if I'm concerned first of all for safety putting anything like that in the crib.
Yeah.
Second of all, like in terms of bumpers, also safety issue. Like, so I'm wondering, in terms of safety, what could you have in the crib that might soften the sleep experience?
Soften the sleep. Okay, I wouldn't recommend putting a pillow in the crib. He's 12 months old now? 13. The bumpers, they're an ongoing issue. For a long time, it's been not recommended for fear of SIDS, but he's well past the critical time for SIDS now. And if you're worried that he's going to bang his head against the side of the crib or get his foot caught in the crib bars, then the bumpers aren't going to pose a major threat. It's not like he can't turn his head away from the bumpers, which is the main reason why they worry about the bumpers when they're younger. You can use what we call a lovey. So if you can find a little stuffed toy or something that he really likes, or a blanket, a small blanket or something, then you can introduce that as an object for him when he gets upset during the daytime. Give that to him to help him calm down, and then use that as one of the things that helps him sleep at night.
He chooses not the same object, they're different objects sort of each day, but he'll pick an object each each day.
Right.
Like sometimes it'll be a shovel.
A shovel. Okay.
Sleep with a shovel.
Yeah, well, you know,
Seriously, such a very passionate little boy.
I would try and introduce something soft.
I know.
Yeah, and just see if he'll,
If
well, maybe you don't need to give him a choice about that. Yeah, so maybe introduce something soft and see if, he'll get adjusted to using that as this lovey to help him go to sleep. It's okay for you to make choices for him too. You get to do that. Yeah. So did I miss anything?
There will
Yeah.
be, there are handouts as well part of the presentation, so yeah, feel free to take those home with you. So I'll let you, everyone to join me in thank you, Wendy, for being
Pleasure.
able to give a wonderful talk today, such important